Yeah, so guys, the vagus nerve, facial nerve, oculomotor nerve, and glossopharyngeal nerve. Okay, and also S2, S3, and S4, which supplies the bladder. No, I will talk about these functions later in the next video. Okay. So now, like this, for example, if this vagus nerve innervates the arterioles. Okay, like this one. In the sympathetic nerve, it also innervates the arterioles, and on their receptor, the muscarinic receptor, and it uh, and secretes a neurotransmitter which is known as norepinephrine, and then it increases the heart rate and the blood pressure. So here it also secretes a substance, a neurotransmitter, and that neurotransmitter is known as a very famous one, acetylcholine. Both of them are very famous, acetylcholine and norepinephrine. So this one, when it receives it, then the vessels, what will happen to the vessels? It will dilate the vessel, the arterioles, and when it will dilate, what will happen? Heart rate will decrease heart rate, and also decrease the blood pressure. So it is also known as the resting response, right? When we are at rest, the parasympathetic nervous system is activated, and when there is a flight and fight response, then the sympathetic nervous system is activated. When if we are in fear, or if there is a stress, then the sympathetic nervous system will be activated, and its nerve endings will secrete norepinephrine, and then it will constrict the arterioles, and blood pressure will rise, and the heart rate will rise. Okay. And if we are at rest and we are trying to be easy and cool down, then the parasympathetic nervous system will release acetylcholine, and it will dilate the arterioles, and the heart rate and blood pressure will go up. Okay, so this was just the normal physiology and a little bit anatomy. So now let me tell you the main points that you guys must remember from this lecture. Okay, the parasympathetic nervous system secretes the neurotransmitter which is known as acetylcholine, and the sympathetic nervous system's neurotransmitter is known epinephrine. Okay, and this one, sympathetic nerves originate from the four cranial nerves, facial nerve, oculomotor nerve, vagus nerve, and glossopharyngeal nerve, and also from the spinal nerves S2 and S4. Its branches comes from them, and sympathetic nerves are originating from T1 to L2. Now another thing, parasympathetic nerves have long preganglionic neuron and short postganglionic neuron. Okay, this one. Sympathetic have short preganglionic neuron and long postganglionic neuron, right? And the sympathetic have long preganglionic neuron and short post. Look, just the vice versa, preganglionic and long postganglionic. Okay, and now there is also one more thing, like there is also a process known as dual innervation and just a single innervation. Dual innervation, like we just told you here, like this one was coming from the vagus nerve and innervating the arterioles. Now one from the T1 comes and innervates the arterioles, and here it secretes epinephrine. This was sympathetic. So there are most of the times it happens that sometimes sympathetic and parasympathetic both innervates the nerves. So you guys must remember, if there is dual, then it is innervating both. And if, for example, one nerve is only innervating the kidney and it is doing only kidney's function, like sympathetic nerves comes and innervates the kidney and does its normal function, sodium absorption, water reabsorption, all those things. So this is single innervation, and this one was dual innervation, right? So thank you guys for watching my video. If you like my video, then please subscribe my channel and like my video. And if you want some more lecture, or if you want me to make videos on other things, then I can also make on other topics. You can write it in the comment section below. And also, if you want my lectures in Urdu or Hindi, in any language, then I can also deliver those lectures. Okay, so you guys can just comment in the comment section. And if you want me to explain something more in this, or maybe something less, then I will explain it like that. Okay, so if you like my work, then please subscribe to my channel and click the like button. Okay, bye bye, see you guys.